I'm Dr. Amanda Punyuan, and I'm an oral medicine specialist. I have my colleague here, Clinical Associate Professor Ramesh Balasubramaniam, and we thought that we'll do a little bit of a fun video for you today on the most commonly asked questions about temporomandibular joint disorder. So this will be a one-take video, so I hope you enjoy this style. For a bit of context, what I did yesterday was that I went to Google and I looked up what are the things that people Google the most about TMJD, and I've written them on these boards here. And Ramesh doesn't know what the questions are, so we'll get started and I'll ask him a few of these questions and then we'll have a little bit of discussion. Alright, so Ramesh, let's start.
Ooh, exciting.
So the first question is, can TMJD go away on its own? What do you think?
Excellent question. So, temporomandibular disorders as a whole tends to be one of these conditions that rarely progresses. Now, what I mean by that is it tends to, with time, improve. Occasionally they can fluctuate, so patients may report, I've had a little bit more soreness this week, etc. But as a general rule, it tends to improve with time.
I think one of the things that we know about temporomandibular joint disorders is that there are perpetuating factors. So in some patients, there are things that will cause their TMJD to not go away. So in a young, healthy individual with no significant psychosocial history, for example, we do expect them to get better. Are there things that you would see in a patient that you would think that maybe their condition, because we know TMJD is cyclical, but is there some patients that you think that their trend is that they would not get much better?
Absolutely. So, it all comes down to risk factors. If there's an obvious risk factor that's perpetuating the condition, you want to address that immediately. Let's keep it really simple. Say, for example, a patient comes in, 15-year-old, otherwise healthy male, and there's clear evidence that this particular teenager clenches during the day. You see it in front of you, patient goes, my jaw's sore, and they're clearly clenching constantly. Now, if you don't address that issue, it's unlikely this particular individual will follow the natural history of TMD. So, it comes down to risk factors.
All right, question 2. I suppose we've already alluded to this, but what will happen if TMJD is not treated? What happens if we don't treat jaw problems?
Yeah, so there's two schools of thoughts here. There is actually some evidence now that if you intervene early and manage things early, it's more likely to heal quicker and patients can get on with it sooner. So if you identify a problem, it's best to treat it earlier. Now the rationale here is then there's less likely to be central sensitization and then all the psychosocial complications that come along with persistent chronic jaw pain. Now there's also the other argument where they've done studies where they've merely observed patients with signs and symptoms of jaw pain and dysfunction, and over time, as we discussed, these patients tend to get better. Now, assuming all factors are even, that's what you'd want to guess would happen to a particular patient. Now, of course, if there are other factors, as we discussed with this young teenager who might be clenching, it's unlikely that if this teenager was to leave his jaw alone, he'd get better. So that would need to be addressed.
So for people that are watching who may not be aware of what central sensitization is, it's usually seen in people with chronic pain, and it's the priming of the central nervous system that makes them more susceptible and responsive to these pain signals. Is that?
Yeah, I think that's a nice way to put it. So it makes their system more hypersensitive, more aware, and so it increases the likelihood they'll feel pain and the pain will be sustained.
And I suppose the other thing about if the pain becomes chronic and central sensitization occurs is that it is much harder to treat. So as you said, intervening early, in my opinion and yours as well, is really key for these patients. All right, great. Next question. We're going well, aren't we? This is a big one. Does stress cause TMD?
This is a very, very big question. Now, what's very clear is there is a correlation between stress and TMD. Okay, so there are some studies that have suggested that patients who have had significant stress, childhood stress in their younger days, etc., are at an increased risk of developing TMD. Now, I've been asked this question before, and I like to use this analogy. Can you imagine two individuals walking down the street and they both trip over this brick pavement that's slightly raised, and they both land on their chin and they both develop jaw pain? Now, within a couple of weeks, if we're talking about the natural history of jaw pain, both individuals should get better. However, if an individual's had a predisposed history of stress, chances are this particular individual will continue to suffer from persistent jaw pain and dysfunction. Now, the other thing with stress is stress, regardless of the site or source of pain, perpetuates pain. So you can get this, for a better word, vicious cycle where stress is making pain worse, patients in more pain, they feel more stress, etc.
And they can't sleep very well, and the sleep perpetuates the pain as well.
And then you're fatigued, and that perpetuates the pain.
It's a whole situation.
Yeah, sure.
One of the things that I'm quite interested in is that myself, Ramesh, and one of our colleagues, Lalama, we wrote a paper on psychosocial factors in temporomandibular joint disorders and the effect of childhood adversity, which I think is very interesting and is something that's becoming more and more well recognized, I feel. All right, next one. It's also a big question. How do you relieve TMJ pain?
Great. So this is a good question. I think the first thing you want to do is view TMJ pain or temporomandibular disorders as a musculoskeletal condition. Imagine if you hurt your knee, what would you do then? Chances are you'd probably stop running marathons, stop running races, you'd rest your knee. Likewise, if you've got jaw pain and dysfunction, there are a few simple rules. You want to avoid chewy, hard foods. A softer diet's more effective. Cutting up foods to smaller pieces, boiling your food so it's softer, much better than harder foods.
No crackling or jerky?
In the short term. Also habits. If you're aware of any habits, parafunctional habits, for example, you've got a terrible habit of chewing nails, pens, chin resting, anything that can sort of aggravate, overuse your jaw, you want to cut out, clenching, etc.
Something that a lot of people don't know, or something that I think is becoming more well recognized with a few papers, is the effect of woodwind instruments.
Yes.
Musical instruments can actually aggravate. So does choir singing.
Yes.
Because they're all things that need your jaw.
Yes. So, like, I mean, you know, in most individuals who sing in the choir might not have any problems, but if you overdo it, yes, you could be that person. And you know, what's interesting is some person might be able to sing for an hour straight without any issues, and you might only be able to do 15 hours because we're just different.
Yes. Yeah.
The other thing to consider, hot packs, heat packs. So you know, perhaps putting a moist towel in the microwave for a minute, make it nice and hot. Put it across the face for a few minutes, and perhaps 4 times a day. That can relieve pain.
Make sure it's not too hot.
Yeah, you don't want to burn your face. You got to be a little bit careful. Also, an ice pack.
For pain relief.
Yeah, for pain relief. Jaw stretchers, as you're aware, Amanda. Jaw stretchers are useful. Quite effective. And massage if it's sore.
Now, if there is a patient who is coming in to see us but hasn't been in yet, and is in a lot of jaw pain, is there anything that they can do at home?
Sure. So I mean, the things I mentioned already, they're pretty useful. Don't forget your simple analgesics. Your over-the-counter anti-inflammatories can help. Perhaps a diclofenac in the short term, an ibuprofen in the short term, paracetamol in the short term. I'd be very careful using this for more than a few days. I think ultimately, any treatment should be based on a firm diagnosis rather than haphazardly using an anti-inflammatory or pain medication to merely mask the pain. So I think a diagnosis in the first instance will be the way to go. But while you're at home and you're desperate, they're reasonable approaches.
Yes. Okay, great. Well, thank you very much for listening and joining us today.
Thank you for having me. I didn't expect these questions, so it was quite interesting.